Hello, good morning, everybody. This is Andrea taking over stories today for Nurse.org to talk all things about clinical nurse specialists. So I'm going to just jump right into it. So what is a clinical nurse specialist? Basically, plain and simple, a clinical nurse specialist is an advanced practice nurse who mainly functions to improve outcomes regarding patients, nurses, as well as system-wide organization, like a hospital, system-wide hospital level. And we also function in 5 basic sub-roles. And I don't even remember all these, so I have to look at this sometimes. So sub-roles being in clinical practice, being a leader, an educator, researcher, and consultant. So that's a lot of things I just said. So let me break it down for you on the next story. So a lot of times when I'm explaining the CNS role to people, I compare it to the NP role a lot because a lot of people are familiar with that, right? So the biggest difference is we have the same foundational education. We take all the same common core classes, but then we each have our own different specialized education preparation. So we break out and we each take on different courses that are more tailored to the CNS role versus the NP role. So obviously you have to have a master's degree to be a clinical nurse specialist, but there are also DNP programs out there. If you want to continue on, you can get a DNP with the specialty of a clinical nurse specialist. So those programs are out there. And then just like any other advanced practice role, when you finish your master's degree as a CNS, you do have to take a certification test and passing that to be a CNS and to become an APRN. So the one thing I will say to that is very important to know is these things differ depending on what state you live in. So it's so important to check your state laws. And the reason I say that is because the state that I live in recently had just acknowledged the term APRN. So not all states use the term advanced practice registered nurse. Some are still saying acute registered nurse practitioners, and that's the only term that they use. So it's really important just to check what your state laws are regarding the CNS role. Some states, CNSs are allowed to act more independently aside from physicians. States like my own, you still need to have physician oversight, and you can prescribe medications with physician oversight. So same kind of thing, a little bit like nurse practitioners. Typically CNSs, you see them, the majority of them are in inpatient hospital settings. It is possible that you can be in a clinic setting, but typically CNSs work in hospital settings. So a little bit about that role. If you have more questions on that, drop them below. A little bit of background on my own nursing story for those who aren't familiar with me. So just a recap, I was very first a candy striper back in the day. I was a volunteer in the hospital just to really see if I was interested in a future in nursing. So I decided to volunteer in the hospital. So from there, I majored in nursing in college, and when I was in college, I became a nurse tech, and then once I graduated, I became a cardiac nurse. Then from there, I went on to work in a PCU and then into ICU, into critical care, which I have to say is my true love that I found in nursing. I love critical care nursing. So it was while I was in my undergrad, so I knew I wanted to keep going and get a master's degree, but I wasn't sure what I wanted to do. I thought for a while I wanted to do NP, and the more I saw what NPs did, I just didn't feel like it was meant for me. I didn't feel like I was called to it. And then I had remembered hearing about the CNS role. Tried to do a bunch of research. I was literally YouTubing day in the life videos because honestly at that time, social media was not a big platform being used for just for healthcare in general. And I didn't work with any CNSs. My hospital didn't use them. So I did a lot of research and just trying to figure out what does the CNS do and making sure that it was something I wanted to do before I committed to 2 years of school. So I decided that's what I wanted to do, and I love the fact that I could still stay on the nursing side of things as opposed to transitioning more to, I feel like, the physician side of things. And I say that because sometimes with NP role, you're transitioning a little bit more to the physician side of things, right? A lot of times you're prescribing. You're seeing patients very similarly to how physicians may. With CNSs, you stay more on the nursing realm of things, is how I like to look at it. You are usually not working side by side with a physician. You can be, but a lot of times you're looking more at how can I help the nurses at the bedside? How can I help these patients on the unit? How can I look back from a big perspective and see how can we improve a process throughout the whole system of the hospital? It's a little bit different. And that's one thing, though, that intrigued me, that I felt like I was gifted at being able to do some of those things. So I decided to pursue CNS and did a 2-year program, and haven't looked back and have loved it ever since. So in talking about what does it look like on a day-to-day basis to be a CNS, it can look so different. To look specifically at some snapshots of what my day-to-day has looked like, check out my page, andreapaddock.cns. I do have a highlight on there that is called day-to-day, and that gives you a little bit of insight of different things I've been involved with. But being a CNS can look so different depending on what population or disease process that you may be over. For instance, some CNSs, they may specifically focus on a disease process like heart failure. Some may be in a specific population like trauma ICU. So depending on that can really determine what your day-to-day looks like. My day-to-day can transition from going from being more in my office because maybe I'm in a planning stage for a project, so I'm doing a lot of reading, researching, writing, things like that. Other days I'm out on the units more helping the nurses. I'm running to codes. I'm running simulations. I'm teaching classes. Running meetings, things like that. It can look so different, and that's one thing that I love about it, is that not one day is ever the same. I will say, to be a successful CNS, you've got to be very self-motivated, self-driven. You don't have somebody there every day telling you, okay, today you need to get this done. Okay, make sure that you go to this. You've got to be very on top of your calendar. You've got to be very just have a good understanding of what do I need to get done, what are steps A, B, and C so that I can reach all the way to my goal that needs to be accomplished by X date, whatever it may be. So you definitely have got to be just very independent, which is one thing that I love about it. I pre-recorded most of what you're seeing today, but one thing that I was thinking about when I was posting today that I wanted to mention is a lot of times CNSs can be misused as just being educators. And I don't say that in a demeaning way, but being an educator is just one of the many sub-roles of being a CNS. And sometimes hospitals, they may not have a department of research or department that is solely focused on CNSs. So sometimes CNSs get grouped in with an education department and are solely used more so for education. But we have more roles that we can play, and you want to make sure that you really are fulfilling the whole extent of what you're capable of doing with your license. So you really don't want to be used as just educating. There's a whole lot more that you have gone to school to learn. So that's just one thing I wanted to point out too. There should be a distinct difference between being an educator in your hospital versus being a CNS. One aspect that's really, I would say, stretched me in my first year as a CNS was the idea of just having a goal of completing projects, submitting abstracts to conferences and things like that. And that's something that's really just a part of being a CNS and becoming a nursing professional in that role, is submitting completed projects that you've done for conferences, submitting to be able to give a podium presentation at conferences. If you've done research studies, getting those things publicized, all of those things should really be a part of your future goals. One other thing that I like that some people may not like is the opportunity to do some public speaking. The more you get into your role as a CNS, you really become an expert in your field. You gain a lot of knowledge about whether it be the population you serve specifically or the disease process you work with all day, every day. But I kind of have a passion for being able to publicly speak about knowledge that I've gained in a particular area that I've grown to love. So that's also one of my own future professional goals, is to be able to speak at conferences. I'm going to wrap up my takeover of Nurse.org stories today. Just want to say thank you so much for all of you who followed along, those of you who have engaged. I really appreciate it. If you have any more questions, please don't hesitate to reach out and follow along at andreapaddock.cns for more of my CNS journey.